Hi everybody, it's Nicole from the Modern Orthodontist. Happy Monday. Hopefully catching a few of you on your lunch break. Just want to start off saying we're talking about Invisalign today, which is going to be amazing. Lots of questions came through that I'm going to try to answer for you. If you're watching the live, drop a 1 below. If you're watching the replay, which means you don't see the live button there, drop a 2 below. And then if you've never seen one of our videos from TMO, drop a 3 below. And if you're interested in Invisalign treatment at all, drop a 4 below in the comments, okay? So I'm going to read a couple questions about Invisalign. Normally I'd have Verna do it for me, but I'm in a little bit of a different location today so that I could still do this live for you guys. So I'll be reading the questions myself. But if you guys have any questions that pop up, please comment them below if it's live, if it's not live, because either way we'll get back to you, okay? I don't want that there. Hi, hello everybody. When you pop on, say hi. Okay, so let's get going. And let's just talk a little bit about Invisalign and our status and Dr. Schnepper. So our status is VIP diamond status, and the reason a provider status, sorry you guys, and the reason that is an important thing to talk about is it really goes into depth and detail about how many cases we've done, how much training Dr. Schnepper has done to do this many cases. We are the #1 provider in Southwest Washington. We specialize and have done the most cases with teens and adults. She gets exclusive training because of the status, which is amazing. So she gets trainings that other people cannot get. If they decide to do Invisalign, they can do some online courses because she is so up there on the rankings. She gets exclusive training, which is amazing. So let's see. Let's just go into kind of what is Invisalign, right? It is a clear aligner therapy, which is like a plastic material, which is BPA free. And it's just a orthodontic alternative. So a lot of people are loving it because they have, I'm sorry, my brain just like, whoa. They're loving it because every tray, they switch every week. It's a lot more comfortable. They're finding that they're having less and less discomfort just because with going in and doctor, again, with all of her training, really specifically looking at every single tooth and the movement of the teeth. You're moving a few teeth at the time to get the best overall diagnosis. So really it's minimal movement per tray, but overall very effective. So very, very cool. Another thing about our office and the Invisalign is new innovations every year. So we are treating now younger kids. So before, if they were in like a phase 1 or early treatment, the only option was braces, and now they can do aligners as well, which is great. And I've had a lot of moms ask or question, you know, if their kids are gonna be able to wear the trays, and we've actually had amazing success with that. Kids actually are doing very well and wearing their trays like needed, so that is an amazing thing. But with that being said, I know a lot of people are thinking, if Invisalign's so great, why wouldn't just everybody do Invisalign? The really cool thing about our office too is we still do braces, and Dr. Schnepper is still highly trained, and we do a special customizable braces. And a lot of kids and adults still want braces, and they like the look of braces, and their friends have braces, and that is totally okay. We've just done a lot of training as a practice and an office, and are really loving Invisalign. So going into the next thing, I have a few pros that are really fun, why people are doing Invisalign, what's so great about Invisalign, and they are, sorry I'm reading from a sheet like I was saying. Verna normally reads the questions and stuff for me, but I kind of am on my own. Speaking of Verna, hi! She just popped on. Okay, so pros. what's so great about Invisalign? So they're pretty much invisible. They're trays that you put in and out. You can take them out to eat and brush, and they're very easy to clean, especially if you're worried about your self or kids having the braces and having extra plaque kind of hanging around. These are really nice because they can pop them out, brush and floss really well, and then put them back in. You're gonna have less appointments or pokey wires, broken things, broken brackets kind of coming off. It's a nice way for everything to be really nice and smooth. We can still do rubber bands, elastics with them. Less appointments and shorter appointment time. So that's another like total bonus, is we only need to see you usually between 8 and 12, maybe even sometimes 14 weeks. And because it is something, an appliance that you'll be wearing yourself, we do need to see you so that we can monitor you and make sure that everything is going as expected. But it's nice because you're not coming in like every 6 weeks to get new color ties and new wires and things of that sort, which helps you with school and helps mom not missing work. And then the appointments are really nice and short. I wanna say our longest appointment you'll ever have with Invisalign is about 45 to 50 minutes, which is great. And those checks, you're usually in and out within like 15 minutes. So very, very cool. Let's see. And again, why would anybody not do it? We talked about in case they wanted braces, but also the really, really important thing with Invisalign is that they're not working if you're not wearing them, right? So you need at least 20 to 22 hours of wear with them in throughout the day. So if you feel like you just know that you wouldn't be able to wear them because of your job, or that's just not your personality type, I guess, then you can always go with traditional. And I don't want to say traditional braces, but braces, because we don't use traditional braces. We use next level customizable braces. 9 months in, such a difference, seen it and felt. Thank you guys so much. Hi, Tim. Thank you. Yes, and it's awesome because if you really are wearing the trays that 20 to 22 hours a day, a lot of patients are getting done early in treatment, which is amazing. How long could you be in treatment? Well, everybody's gonna be different. We, of course, have a complimentary exam. We don't do the gooey impressions anymore. We have a scanner, so we scan you for your impression trays. And it's a quick, 45-minute exam. And then Dr. and our treatment coordinator, Melissa, will go over all of that information with you. And really, if you just need a few trays for a couple little teeth, or you really have complication, I shouldn't say complications. I'm losing the word I need here. If your treatment's a little bit trickier, it could take longer, but really we have seen a ton of our patients end up getting done early, which is amazing. Do you need to remove them when drinking? Eating and drinking, yes. You can keep them in for water, but if you're drinking things like coffee or sodas or anything like that, you'd want to take them out. So, and how much does it cost is always a big one, right? We do not charge more for Invisalign than we do braces. And again, it's really person to person because everybody's treatment is going to be different. If you need 5 trays, if you need 10 trays, if you need, months in treatment or a year in treatment, it's really, really different per person. So let me make sure I got everything. Please drop some questions below if you guys have any questions, because even when I pop off the live, we can always come back in and answer the questions anytime. Make sure to like this video, share this video with your friends and family. Tag any friends that you know are interested in treatment. And let's see. I feel like I kind of covered everything for today. There is a lot of information on Invisalign, so we'll probably go live again with some more information, but I'm just gonna kind of do what I did at the beginning real quick, and just, if you're watching live, drop a 1 below. If you're watching the replay, drop a 2. If you've never seen us or any of our videos, drop a 3. And then of course, if you're interested in Invisalign treatment, I'll put a 4 in the comments below. So I hope you guys have a great Monday. I would also love if you guys would comment if you guys have any gosh, what am I thinking? Any topics or categories that you guys would like us to cover in the future. I'm gonna go live every other Monday, so if you guys have anything that you guys have questions on or think would be a great topic to talk about, I would love that resource so that I can get back to you. Okay, so you guys have a great Monday, and I'll see you in 2 weeks. All right, guys, bye.